Okay, we're in the office today and we are going to be treating a patient for plantar fasciosis. She's been dealing with plantar fasciitis type symptoms for over 10 years now. Her primary activity is dance, and she has been having just constant heel pain on the bottom part of her heel, right where that plantar fascia inserts at. She has had treatment in the past, massage, Graston technique, or using the metal tools to scrape into the tissues with some success. She's had a little bit of ultrasound therapy, which has allowed her to do all of her activities, but just hasn't fully resolved. So today we're going to go through a shockwave treatment, and shockwave is this device over here, and what it does is it sends acoustic waves into the tissues. So it essentially sends sound waves into the tissues. So that sound wave essentially goes into the tissues at a cellular level and causes a little bit of mechanical disruption at the area. And in doing so, it will irritate the microvasculature in the area. So that will help increase some blood supply. Once it gets irritated, the body kind of sees it as a new injury and sends growth factors there to repair. So that increases that blood vessel formation and increases the blood supply to the area. The other thing in chronic pain syndromes is that there's some buildup of neurotransmitter called substance P, which then will elicit the pain response in the area and send the activation up those pain fibers up the body. So by doing the shockwave approach, we can decrease the amount of substance P in the area to help decrease the amount of pain sensitization in the area. And then the final thing that we're going to use the shockwave for is we're going to try to treat the whole kinetic chain here. So we're going to use the shock waves and the acoustic waves to break down myofascial adhesions within the calf musculature, that a lot of times plantar fasciitis symptoms are dependent on how tight and how much mobility there is in the calf musculature themselves. So we're going to use the treatment up in this area, and then we're going to work the entire plantar fascia into the forefoot and into the arch of the foot here. All right, and just to see where we're at today, Sarah said that her pain level on a day-to-day basis is about 5 out of 10, and by the end of the day might get to 6 or 7 out of 10. And just pressing in on the heel into that insertion, how painful is that, Sarah?
7, maybe 6.
Okay, so 6 to 7 out of 10, just with some pressure right into the insertion point of the plantar fascia. So we're going to start by using some ultrasound gel here, and we're going to put it all onto the muscles we're going to treat. Okay, so we're going to start the therapy here, work the calf musculature first down towards the Achilles and hit all the muscles, the trigger points that we found in the tissues, and then we're going to work into the bottom of the foot and get into that plantar fascia a little bit more specifically. All right, ready, Sarah? Okay. Now, shockwave treatments are generally not painful. You feel some pressure from the sound waves, and once you get into areas where there is some myofascial trigger point or myofascial adhesion, you might feel some achiness, a little bit of soreness when you're getting the treatment done. But this is a very effective treatment for musculoskeletal pain, and the treatment protocol is just 1 time a week. Treatment's less than 10 minutes and can often be that next level of care when other treatments like physical therapy, massage, ART, active release technique, if those treatments plateau or don't take care of the issue completely, shockwave is an excellent therapy to try. All right, so now we're going to treat right into the bottom of the foot, into the plantar fascia and the small muscles of the bottom of the foot. And then once we get up towards the heel, we'll switch out the head. We're going to do a little bit more of a focused approach into that area. All right, Sarah, you ready? Doing okay? So now we're going to swap out the head here. This part has a little bit more of a focused head for the sound waves. And we're going to get right into the actual insertion point of the plantar fascia. All right, Sarah, so I'm going to start over here and I'll work our way into the tender point, and just raise your hand if it gets a little too much, okay? Achy as I get up there?
Yeah, right there.
Okay. Okay, so that's a typical shockwave treatment that we would do for plantar fasciitis. Again, loosening up the calf musculature and the bottom of the foot, and then we get real focused in right on that insertion site of the plantar fascia on the bottom part of the heel bone there. Now I just want to see how we did with the treatment. Sarah, how's that feel as I push into the tissues?
A lot better.
Is it still a little sensitive?
Maybe just a tiny bit on the outside there,
But overall, and I'm pushing much more firmly into the tissues than when we first started. So give it a number, 0 from 10. How painful is this right now as I'm pushing in?
1.
Okay, so 1 out of 10. We started, it was more, I think you said 6 to 7 out of 10.
Yeah.
So substantial improvement just after the first visit. And these treatments, the protocol is anywhere from about 4 to 6 visits, 1 time a week. And it's just real quick, about 10 minutes worth of this shockwave type therapy. And then after the 4 to 6 treatments, then we wait an additional 4 to 6 weeks because those cellular effects that the sound waves produce, that there's this kind of what's known as like an afterburn effect to the treatments, to when you get that last treatment that there's still a lot of cellular mechanisms going on, regenerating in the area that helps a lot with the complete recovery of the condition. And then if there's still some symptoms that remain after that period, we do a re-exam and we see if we need to do another set of treatments depending on where the patient's at that time. But that is, like I said, the typical treatment that we'll do using shockwave therapy.